time. 6 years cancer free, yeah, I wouldn't have a problem doing lipo on you if being 6 years cancer free. And congratulations on that. Hi, Tiana. Paniculectomy and fleur-de-lis? Is that what you're asking? Right. So the 360, are you talking about liposuction or the body lift? Seroma is excess fluid collecting underneath the skin in the surgical bed, which is why we put drains in to catch the fluid and pull it out. Exparel is a form of local anesthetic that's placed underneath in the surgical bed during surgery to keep for pain relief. My surgeries, it depends on what the person's getting. So some people are required to stay overnight in the hospital. It depends on what operations they're getting. I'm plus size and would like to go the lipo route in my belly and breast implants. Is this something I would be able to do? It depends on what your definition of plus size is. If your BMI is over 33, I would not do liposuction on you. But there are some doctors who would. I don't think it's a good idea. And the bigger you are, the less likely you are to be happy with the liposuction. No, you don't need to be in a garment after paniculectomy. I do have people wear an abdominal binder for a couple weeks after, but you don't need a garment after paniculectomy. BMI for BBL will be the same as liposuction, 33 or under, for me. I had more lipo done in December, and if I go an entire day without I'm assuming you meant faja or garment, I look like I'm 2 or 3 months. The more times you have liposuction in the same area, the longer the swelling persists. So if you got redo liposuction of an area that already has been lipoed, you will need the garment for longer than 3 months, most likely. Because every time you go back to the same area, more channels are damaged. So fluid collects there and gets trapped there a lot easier, and it takes longer to resolve the swelling. Okay. Yes, Carla, yes. When having lipo, 360 lipo, any kind of lipo, is it true that the longer you stay in your compression garment, the better your result? Yes, that's true. The garment is your friend. So when people try to slick their way out of the garment, all you're doing is compromising your own result. If you take that garment off and you see that you're swelling back up, you need to put the garment back on. And if you don't, you're only cheating yourself, and that's your money that you wasted. No. If somebody's there for a paniculectomy, they get a paniculectomy. They're not the same price. It's 2 different surgeries. So I wouldn't just be like, oh, I'm going to just do a tummy tuck when all they signed up for was a paniculectomy. That's kind of, that's actually unethical to go and do a surgery that they weren't consented for. But also, I wouldn't do a surgery that you didn't pay for. And a paniculectomy and a tummy tuck are not the same. One takes way longer than the other. You can massage the knots to help them go down some. That's why lymphatic massages are good. But tummy tuck and lipo at the same time, and you got hard spots in that's dead tissue, just like I was talking about earlier. I did the seroma and exparel thing already. Shawan, I just talked about that about 5 minutes ago. It depends on is a person with MS remission a candidate for surgery? It depends on the rest of their medical history, their medications, all that kind of stuff. It's not a good idea to get liposuction if your BMI is too high because, one, your complication profile increases, and two, you're less likely to notice a difference. So there's only so much fat that should be taken out in one setting. And if I go and liposuction you and take 4 liters of fat out and you look pretty much the same because you were so big to start with, you're going to be mad like I look the same, and I'm going to have an attitude that you're saying that after I spent all of my energy and time taking out 4 liters of fat. So that's why that's a big reason why my cutoff is where it is, because when I used to do liposuction on people with a BMI up to 35, and it was those 35ers that would be like, I just don't really see that big of a difference. I mean, it's just, I thought it would be more. And I will have slaves taking all this fat out, and they feel similar because they were too big to start. It'll take way more fat to be removed in order to see a difference, except it's not safe to take out too much at one time. So it just takes too much to see a difference. So now you're being put at risk. Tummy tuck help with the weakness of your lower back? Not really. No, broken veins are not a sign of blood clots. It's a sign of like the valves in your veins that are returning blood up to your heart sometimes get broken. But it doesn't mean that you have blood clots. An A1C of 6 is okay. A tummy tuck doesn't affect your organ function unless you're tucked too tight. So if you're tucked way too tight, then I guess technically it could cause what's called a compartment syndrome inside of your abdomen, which could affect your organ function. But that doesn't really happen. Most people will not go and do that. The drains for a BBL, that's surgeon dependent. Like, some people put drains in, some people don't. So, thoughts on drainless tummy tucks? I don't do drainless tummy tucks. But people who do drainless tummy tucks have a higher seroma rate, period. It works on a lot of people, and then it doesn't work on enough people that made me say I ain't doing it. So seromas are a pain to deal with for the patient and for the physician. The fluid is made after you have surgery, and it needs to go somewhere. So a lot of the techniques they have for drainless tummy tucks does help cut down on the amount of fluid that's produced. But fluid is still produced, and it doesn't have anywhere to go. So a lot of times, I'll do those. I don't do it all the time, but I've done those methods that are out there to make a drainless tummy tuck have a high likelihood of success. And I still left drains in, and the drains were able to come out sooner than usual, but I wasn't brave enough to go drainless. And with the people that I put drains in after I did those techniques, they still had fluid still came out of the drains. Like, they got the drains out like 2 or 3 days earlier, but they still had them and they were still draining. So I just think it's not worth it. Oh, okay. This is a great question. I don't know what happened to my question, but I wanted to know about stomach swelling after breast reduction. Is that common? I didn't see anything about it when I did my research, but since I've read articles about chest fluid and gravity moving into the stomach and even the thighs, can you speak briefly on that if you don't mind, please? Okay. Okay, I don't know about all the fluid from your chest going down to your stomach. That's not what usually happens. I'm not sure where you read that. But what does happen, and whenever I do breast reductions, I tell my patients this beforehand. Almost every breast reduction client will say after they have their breast reduction, my stomach has been bloated ever since surgery. They all say it. It's not that their stomach is bloated. It's that their breasts aren't over covering it up anymore and they can see it. Like, that's literally what it is. Belly was always like that, but it was breasts laying on top of it before. And now that your breasts are up on your chest wall where you can see it, it makes your stomach seem bigger. Like, every breast reduction patient says the same thing. And then they get used to it. Once you can see it, you can actually, it looks different. Because usually if you're getting a breast reduction, especially when it's covered by insurance, your boobs are so big that it's covering your stomach. My out-of-town patients usually get their drains removed before they leave. 90% of the time. So you have to be here for 14 days, and drains usually come out in 7 to 10 days. Arm lipo doesn't always make your arms look flabby and saggy. I don't know what your arms look like, though, and that might be why your surgeon advised against it. So that's one of the things to consider when you're considering arm liposuction is the quality of your skin. So if your skin is damaged and stretched out already, and then you go and deflate it, it will be, you'll have wings. But if you have nice, good, supple skin and you get liposuction, it should shrink. The skin should shrink. I do a lot of arm liposuction. If you have lipo, yes, you need to sleep in the garment. I usually put my patients in there, if they're a tummy tuck, I usually put my patients in their compression garment after the drains come out. Liposuction patients, I don't put drains in. Mommy makeover, it depends on what your mommy makeover consists of. When getting a BBL, is it better to not have a tummy tuck at the same time and use that fat? That's what I think. But I don't do a lot of BBLs, so you probably want to talk to a surgeon who does those more. I don't do a lot of BBLs. But I know I would not do a tummy tuck and a BBL at the same time if I need fat from their stomach. They're both liposuction and liposculpture. They're both liposuction. And one of them, you do a little more, it's like more detail in it. It's more detail work in liposculpture. I hate, okay, and Forever Queen, this is one of my pet peeves. I cannot stand how women call themselves dolls when they get plastic surgery. You're not a doll, you're a woman. You're a real person, you're a human. You have life and a heartbeat. And I think, like, I don't know, calling yourself a doll or calling yourself by the surgeon's name and then a doll after it, I feel like dehumanizes the whole process, which is why people keep dying. You're a woman, not a doll. A doll is fake. A doll looks fake. A doll can't die. Like, I just think that all that stuff just dehumanizes women, and that's why people keep getting themselves in trouble. That's just one of my pet peeves. I just really hate how people have done, like how people like, so I'm such and such a doll. Please, nobody call themselves a Bennett doll, please, because it will make me want to throw up. I don't like it. Hernia is fixed alongside a tummy tuck with muscle repair, yay or nay? That happens a lot. The only thing about a hernia repair that's in your belly button, at the same time as the tummy tuck, is it does increase your risk of the belly button dying depending on the size of the hernia. So there is a little more risk involved with that if it's an umbilical hernia. Thank you, Melody. The most fat I will take out in one operation is 5 liters, although I've only done that like 3 times.